Hello everyone, so we will start this session. This is the Abdomen and the Pelvis MCQs part 4. So this is for targeting the NEET PG examination 2022. So let me know, am I audible? Is the screen clear? So let me just check. Okay. So yes, my dear aspirants, we will again solve the MCQs related to the topic. Before that, meanwhile the aspirants are joining, I would like to give you quick introduction about myself. Myself Dr. Monalisa, and I have got a total of 8 to 9 years of teaching experience. So okay, let's talk about the special class feature. So when we are talking about the special sessions and which is being taken on the free platform of Unacademy, it's an interactive session where the learners can interact live in the session. You can also participate in the polls. The polls are conducted which can where the learners can participate. Never ever miss a session. Raise your hands and get your doubts clear. Never ever miss a session. What is this function meaning? So this means that when you are present for the session and you like the session, you can follow the educator on the Unacademy app, and thereafter you will get notification regarding the session taken by that educator. So once the session is finished, you can also download the PDF notes. Anytime, anywhere, read from the top educators of Unacademy platform. And for enrolling and for attending special free sessions, for the first time, the users can use the code NAT10 after downloading the app Unacademy. Now let's talk about the previous year general embryology MCQs that will be taken tomorrow 7 p.m. and also for the first year aspirants 6 p.m. is a session which is targeting for the important topics. So I am targeting important topics for the university exam of first prof students. So university exam, so 2 sessions, 6 p.m. and 7 p.m. session which will be highly beneficial for you. So my dear aspirants, you can use the code NAT10 for enrolling if you want to see the session for the first time and you attend it live. Plus subscription के लिए all 19 subjects completed in a very systematic way. Study from top educators of Unacademy platform. Dr. Kaustubh, welcome. Compete in live tests and quizzes. Study on the device of your choice. Assess 25,000 MCQs, high-yield MCQs, which is also provided with a explanation to each and every MCQs, and with soon you will be provided, if you are going to take the subscription of 1 year and more, you will be provided with printed notes or plus subscription of Unacademy. So iconic subscription, the benefits of 2 platforms, Unacademy and the Prep Ladder, best of the 2 platforms can be assessed by you. Benefits of Unacademy has already been told you. Benefits of the Prep Ladder is clinical integrated essentials, video lectures from the Dream Team, QBank 3, rapid revision, snapshots and treasure dream notes 2021. All these can be assessed by you. Use the code ANAT10 for extra 10% discount. So pricing detail of Plus and Iconic has been compared and shown to you. This will help you to decide whether going for Plus or Iconic. Students of next NEET PG, so sure go for Iconic subscription. Get an extra discount by using the code ANAT10. Also study with me with anatomy test series which is going to happen on 21st Jan, that is on Friday at 9 p.m. is the timing. Get enrolled for the test by using the code ANAT10. You can be enrolled for this test and this will be highly beneficial for you. Exciting rank and prizes are waiting for you of Amazon vouchers. So do participate on 21st January 9 p.m. session. Use the code ANAT10. Now, let's talk about NEET PG Compact 60-minute test. 45 MCQs are there. NEET PG Compact is back. The topic is medicine, derma, anesthesia, psychiatry and radiology final year subjects. A pool of 10 lakh rupees is there, and Amazon vouchers, gift coupons for 50 participants until 200 rankers can win a scholarship. So just go for it. Use the code ANAT10 for enrolling in this test, which is going to happen on 23rd January 11 a.m. I would also like to tell you that boost your medical preparation, my dear aspirants. Boost your medical preparation of NEET PG, which by taking the subscription, which is valid till tomorrow, valid from 18th, that is today, till tomorrow. So take 2 years of subscription and get 4 months of subscription free. Take 12 months of subscription, get 2 months of subscription free. Use the code ANAT10 for getting extra 10% discount. Congratulations to the toppers of FMG December session 2021. All the best. I am very proud to share their images with you, and all the best to them, and also my blessings that they should crack the NEET PG exam in the first go. Now, highly effective QBank of 25,000 and more clinical MCQs of all 19 subjects made by the top educators of Unacademy platform with a detailed explanation provided with it, and you can have an access to all these 25,000 MCQs. Get enrolled by using the code NEET10. So 2 batches are there currently on the, so among many batches, 2 important batches are there: Target NEET PG 2022 batch MCQ discussion and Focus FMG 22 comprehensive batch. So go for it, take the subscription, use the code NEET10 for extra 10% discount. So let's start with the session now, everyone. All the best to everyone, all the best to everyone, so that we can start the session now. So let's start with the first MCQ. If cirrhosis is the cause of obstruction of portal circulation within the liver, portal blood could still be conveyed to the caval system via which of the following? Okay, options are azygous and hemiazygous vein, gonadal veins, internal iliac vein, splenic vein. According to you, which is the best answer? If cirrhosis causes obstruction of portal circulation within the liver, so blood is conveyed, still conveyed to the caval system via which of the following? So your time starts now. You will get 30 seconds for marking the correct answer. So what is the correct answer, dear? Dr. Kaustubh, everyone? So here the key points which is provided. If I talk about the key points are the cases of cirrhosis of liver, portal circulation maintained within the liver. So portal blood could be will be still conveyed via caval system blood. So you have to search for the caval system blood, which is still active in this case. So according to you, which is the best correct answer? Okay, everyone. So the correct answer here is azygous and hemiazygous vein. Okay, A is the correct answer, my dear aspirants. So I got an answer from Dr. Kaustubh. Yes, A is the correct answer, absolutely correct. Actually, this is the case of esophageal venous plexus. So actually the esophageal venous plexus drains into azygous hemiazygous vein within the thorax and has got anastomosis with the left gastric vein. So jab esophageal venous plexus is formed, there is formation of anastomosis between the azygous and that of hemiazygous within the thorax, and there will be anastomosis with the gastric vein. Okay, my dear aspirant, thus following the blockage of portal vein, the portal blood may enter the superior vena cava through azygous vein. So we have chosen azygous and hemiazygous vein as the correct answer. Now other options which were given, and before that I would like to show you the important site of portocaval anastomosis. Okay, so yes, important site of portocaval anastomosis, as you can see it also happens in the rectum between superior rectal vein and that of middle and inferior rectal veins. Paraumbilical vein, that is with the epigastric vein, resulting in the radiation of the veins as shown around the umbilicus. That appearance is called as caput medusa. Colic and the splenic vein with renal veins and the veins of posterior abdominal wall. So actually what I have written here are the important portocaval anastomosis which is happening between the rectal vein, superior rectal vein with middle inferior, paraumbilical vein and epigastric vein, and colic splenic vein with the renal vein. I would also like to show you a diagram for it, where you can see important site of portocaval anastomosis, paraumbilical vein to the body wall and paraumbilical vein of the portal system. The other is esophageal, which has been asked here, and we are already knowing that left gastric vein anastomosing with the azygous system of vein. Rectal के site में middle rectal vein to that of the superior inferior rectal vein, and also retroperitoneal near the body wall, lumbar vein and the gut wall. So all these are important site of anastomosis, and the veins which is forming the anastomosis is a very important topic for your MCQ session and for your NEET PG examination. Okay, you have to know what is you have to know the location of esophageal esophageal varices. You have to know the anastomosis within the rectal vein, paraumbilical vein. Now the other options which has been provided, the gonadal vein has been provided as one of the option. It is exclusively draining the gonads. Okay, So actually gonadal veins means testicular and ovarian vein, and we know that it communicates with uterovaginal plexus and it is not having any anastomosis with the portal vein. Okay, internal iliac vein was the other option which was provided, and we know that internal iliac artery vein are providing mainly draining the pelvic region, and it is having not demonstrated to have any anastomosis with the portal anastomosis. So these two are the wrong option, and we are marking correct answer as azagus system of vein. So yes, my dear aspirants, I think the concept is clear to everyone, Dr. Kaustubh and Mulai and everyone, and most of you have marked the correct answer also. Okay, so very nice. So let's move on to the next one, that is MCQ number 2. Okay, before that, splenic vein is also incorrect because it itself is a portal venous system. We have to search for the caval system vein. So ये wrong option है. Vesical venous plexus is also wrong because it is situated in the pelvis and drain prostrate and the bladder, and it is not having any association with the portal vessel. So these two options are also absolutely wrong. Let's move on to the next, that is question number 2. A 42-year-old man has got an automobile accident and suffered severe pelvic trauma. The bulba, pelvis and urethra were torn from the inferior surface of urogenital diaphragm. So, okay. This has allowed the urine to extravasate from urethra into which of the following reason? Whether it is deep perineal space, ischioanal space, retroperitoneal space, superficial perineal space. 4 options are there, mark the correct answer. So 4 options are there, question number 2, mark the correct answer. I got an answer from Mangla, Rochan Mangla, D. Okay, what about others? Question number 2. Okay, so many of you are giving the right answer. Actually, the key point which is provided here is the bulb of penis and the urethra is torn. That means bulbar urethra. What is the injury? That means which part of urethra has been injured? That means injury is occurring in the bulbar urethra. Injury is occurring in the bulbar urethra. Okay, so that is clear here. Okay. Yes, Srija Kundu, absolutely right. And so don't get confused with the word of inferior aspect of urogenital diaphragm. Actually, inferior part of urogenital diaphragm is covered, if we talk about the inferior surface of urogenital diaphragm, it is the perineal membrane, and perineal membrane is also forming the upper boundary for the superficial perineal space. So the correct answer will be superficial perineal space. Actually, it is important that we should know when the membranous part of urethra is torn, that means if there is injury inside the urogenital diaphragm and membranous part of urethra is torn, then the extravasation of urine will be in the pelvis but in the extraperitoneal space. But when the injury is in the penile part, bulbar part, spongy urethra, the extravasation of the blood or the urine will be occurring in the superficial perineal space. So whenever there is injury to the bulbar part, what happens? There will be firstly the superficial perineal pouch is filled with the blood or the urine, and after that what happens? If we want the further extravasation of this urine or the fluid, it will extravasate in the superior aspect and can go to the anterior abdominal wall deep to the scarpa fascia. If we talk about its drainage in the lower, if it is draining in the lower aspect, it can't drain below the Holden's line. If you remember, the scarpa fascia of the abdomen continues lower down and get attached. Actually, it enters the thigh, and the membranous part of superficial fascia get attached with the deep fascia of thigh at the Holden's line. Because of the presence of Holden's line, the urine or extravasation of urine is not going to happen lower to it. So anyone has got any doubt, let me know. So question number 2, D is the correct answer. So all other options, see here, the other option, that is ischioanal space, deep perineal space, retroperitoneal space. So my dear aspirants, all other spaces which has been mentioned here totally shut down the bulbous urethra. In case of bulbous urethra injury, if the bulbous urethra is mentioned, the injury and the extravasation of urine will be in the superficial space, superficial perineal space. So we will go with D as the correct answer. So I just want to show you this diagram. See here, in this diagram, we can appreciate the ruptured bulbar urethra. Here, this is a case of ruptured bulbar urethra. Now, the urine is accumulating in the superficial perineal pouch. See here, and superficial perineal pouch is formed. Can anybody tell me? Superficial perineal pouch is the space which is lying between perineal membrane and Colles fascia lower down. Okay, so perineal membrane, so that means lower part of urogenital diaphragm. Actually, lower part of urogenital diaphragm is lined by inferior layer of urogenital diaphragm and inferior layer of urogenital diaphragm. So here this layer will be the inferior layer or the perineal membrane, P for perineal membrane, and this layer will be the Colles fascia. This will be the Colles fascia. So exactly the extravasation of urine is occurring in the superficial perineal pouch with no doubt, and from here the urine extravasation, after filling the space of superficial perineal pouch, it can also traverse in upward direction, and you can see it is passing in upward direction deep to the membranous layer of the lower abdominal wall, membranous layer of the superficial fascia of anterior abdominal wall, and as you can see, but lower down it can't enter into the lower limb below the level of Holden's line. Why? Because at the level of Holden's line, the membranous fascia or scarpa fascia merges with deep fascia of the thigh. So, and everyone, should I write it or is it okay? Should I write this information or you are understanding? Let me know. Sirja, Mulai, Mangla, everyone. Is it okay? Arnold, Kostub, Dr. Kostub. So, should I write it or is it okay? Okay. Done with this, my dear aspirants? Done? Okay. So, one line you can just write in if membranous, one line, if membranous, okay, please write, okay, okay. So, yes, Mangla is telling please write. So, if, please write on if membranous urethra is injured, if membranous urethra is injured, so the extravasated urine will enter the pelvis, but the collection of urine will be, it's okay enough, okay. So, its collection of urine will be in the extraperitoneal space, in the extraperitoneal space. So, okay, I will quickly write few points and then we will move on to the next MCQ. Okay, no, it's okay, all my students are the, it is important that everyone should write their doubts and they should understand, and it happens at times later we can forget, so we should write down this important point. And when, if bulbar urethra is injured, so if bulbar urethra is injured, the extravasation of urine occurs in which space? So extravasation of urine occurs in superficial perineal space. Superficial perineal space. Okay. From here, the accumulation of fluid can pass in upward direction. From here, accumulation of fluid or urine or blood, anything which has been injured, can pass upward and will pass to anterior abdominal wall deep to scarpa fascia. This will produce swelling, and the extravasated urine, this will produce swelling. In this case, the swelling will be in this will produce swelling in the perineum, in the scrotum, and infraumbilical region of anterior abdominal wall. Okay. Okay. Now, lower down, another important point which I have explained you. So, we have done with the bulbar urethra injury. Other important point which I have explained you, that lower down the urine collection doesn't goes to lower lip. The reason is that merging of the scarpa fascia with that of Holden's line. Holden's line is the line where the membranous scarpa is merging with the fossa lata. Okay, let's move on to the next MCQ, that is MCQ number 3. Question number 3. Let's move on to third number MCQ. A 17-year-old student is brought to the emergency room displaying vomiting, fever and diarrhea. The patient reports that for a period of 24 hours prior to admission, he suffered from abdominal pain, first centered around the navel and then it is moving inferiorly to the right. Okay. As the patient talks, you realize that he is gesturing towards McBurney's point and you tentatively diagnose that this is a case of acute appendicitis, requesting an emergency surgery to be done. Accurate visualization, identification of the appendix during the surgery can be verified by which of the following landmark? Options are bifurcation of abdominal aorta, epiploic appendages, hostration, tinea coli. Question number 3. Which is according to you the correct answer of identification of appendix? Your time starts now. 30 seconds will be provided to you. Mark the correct answer. Question number 3. Mark the correct answer. Okay, I got an answer from Kabuli, Arnold, Mangla. Okay. Aspirants. Okay, let me come up with the right answer. So, okay, I got an answer from Arnold and Mangla. What about others? What about others? Actually, the correct answer here is, I got an answer from 134 to tinea coli is the correct answer. Tinea coli is perfectly correct answer. So yes, tinea coli is perfectly correct answer and all of you, Basant, all of you have given the correct answer. Actually, we have got 3 cardinal features for large intestine: appendices epicoli, hostration and tinea coli. So first thing is that these features, what is this, is must to be known to you. And what is the important part for the identification of appendix is that actually tinea coli is a longitudinal band, muscle coat, longitudinal band or muscle coat which is running longitudinally over the large intestine. Now, these longitudinal muscle coat or band is converging towards the base of appendix. So, we have got 3 tinea coli and all these 3 tinea coli are converging to the base of appendix. So, we will go with this tinea coli as the correct answer for identification. I would also like to show you this diagram. So, the position of appendix varies depending on the patient. Tinea coli are the 3 longitudinal bands of smooth muscle which is running along the entire course of the colon. Since appendix is a part of colon, tinea coli is accurately followed to this structure. Other important point is that the tinea coli, the 3 tinea coli will converge towards the base of appendix, So, all these 3 tinea coli will converge towards the base of appendix. Okay. So, yes, I would also like to show you a diagram for it. The first thing is the cardinal features. So, large intestine has got 3 cardinal features: tinea coli, appendices epicoli and sacculation and hostration. So, I would like to give you the detail of each. So, these are the bands. So, if you will see in this diagram, this is exactly the band which is called as tinea coli. This is the tinea coli which you are seeing. Other than that, the you can see here, these are the appendices epicoli, and again other than that you can see this is the hostrations which is visible on large intestine. So, tinea coli, sacculation and appendices epicoli. 3 cross section, this is the 3 cardinal features of large intestine. When we are talking about tinea coli, it is the longitudinal muscle coat which is lying over the whole of large intestine, and the tinea coli will contract lengthwise, and when the tinea coli contracts lengthwise in the large intestine, it produces sacculation or hostration. What is appendices epicoli? It is just the pouches of fat pouches which is present over the surface of large intestine is called appendices epicoli. So, these are the 3 features of large intestine. Now, here also you can see tinea coli, tinea coli, tinea coli. Now, all these tinea coli here converges at the base of appendix. So, all these tinea coli is converging over the base of appendix. Okay, base of appendix. There is another diagram which I will show you. See here. Here you can see we have got this as a tinea coli, we have got this as a tinea coli, and this is as the tinea coli. All these tinea coli, if you will see in this diagram, you can see here all these tinea coli is converging towards the base. It is converging towards the base of appendix. So this is the most important feature for diagnosis and to know that this is appendix. The tinea libera, the omental tinea or mesocolica tinea. 3 teneas we have got. Okay. So these all 3 teneas are converging towards the base of appendix. So this is how we are going to identify the appendix. Now, my dear aspirants, I would like to tell about the other options which was given, and thereafter I would also like to tell you about, so let me just rule out the other option, and thereafter I would also like to tell you about the tinea libera, tinea omentalis and tinea mesocolica location in terms of large intestine. Is it okay? So that you can revise. So bifurcation of abdominal aorta can't be the correct answer which was given in the choice A. Okay. Why it can't be the correct answer? The reason is that bifurcation of abdominal aorta, it's located at the inferior border of right kidney and it is a retroperineal, could not be any point of value for identification of appendix. Appendices epicoli has given as the choice, but again we know that these are small pockets of fat tissue along entire course of the colon, not specific to only appendix. Hostration, it is also not specific to appendix. Actually, entire large intestine will have hostration, and we know that hostration is produced due to longitudinal contraction of tinea coli. So yes, so we have got all these incorrect option. The other thing which I want you to tell, so basically let me just rub these. The other thing which I want you to know is the 3 tinea coli. So let me just give you a brief about the 3 tinea coli. See here, the 3 tinea coli are tinea libera. Okay, so when we talk about tinea libera, it is placed anteriorly. What is the location? Tinea libera is placed anteriorly. The location is this longitudinal coat is, longitudinal muscle coat of smooth muscle is placed anteriorly in the location of cecum, ascending colon, transverse colon and sigmoid colon. Okay, this is the first option. The other point of view is its location inferiorly lies in the, so yes, ascending colon and descending colon. So sorry, here there will be the word descending colon. Okay, please note down. So the location of tinea libera is lying anteriorly in cecum, ascending, it's exactly lying anteriorly, as you can see in the ascending colon, sigmoid colon, but inferiorly in transverse colon. Got it? Okay, now the other is tinea mesocolica. The second point is tinea mesocolica. So the second is tinea, write down, mesocolia. Tinea mesocolia. When we are talking about tinea mesocolia, the tinea mesocolia is placed posteromedially in the location of, again, cecum, A for ascending, D for descending colon and sigmoid colon. Okay? And in transverse colon, when we are talking about transverse colon, it is placed placed more posteriorly. So in transverse colon, the location is posterior. The location will be posterior of tinea mesocolica. So 2 teneas we have done. Which is the third one? The third tinea is tinea omentalis. The third tinea is tinea omentalis. Okay, so when we are talking about tinea omentalis, again its location will be posterolaterally. The location will be posterolaterally in case of cecum, A for ascending colon, D for descending colon and that of sigmoid colon. So only transverse colon के according the position of this longitudinal band changes. So, and when we talk about transverse colon, it is situated more anterosuperiorly. It is lying, tinea aumentalis lies anterosuperior in location in respect to transverse colon. In respect to transverse colon. So my dear aspirants, is this difference of the three tinea coli? Okay, everyone, have you understood? I have written everything here because in this diagram we have already seen that the three teneas here, we have seen the three teneas is converging towards the base. I just want to give you the detail of the location of the three teneas. So done everyone? Okay, so let's move on to the next. Let's move on to the next MCQ everyone, all the best. Which of this is an anastomotic artery along the border of large intestine? Which of these arteries which is provided here, arcade artery, arteria rectae artery, coronary artery और marginal artery? So ये चार आर्टरी में से कौन सा आर्टरी है जिसे हम anastomotic artery along the border of large intestine कहते हैं? Your time starts now. 30 seconds will be given to you. 30 seconds. Which of these anastomotic artery? I got an answer from Mangla, marginal. Okay, what about others? What about others? All these are previous year MCQs. Okay, aspirants, क्या है answer? Waiting. I got an answer only from Mangla. Rochan Mangla has given the right answer. What else? Anyone else wants to give the answer? So yes, Mangla, you are absolutely right. D is perfectly correct answer. Mangla is absolutely correct. Anastomotic artery along the border of large intestine. So that is marginal artery. That anastomotic network is quite evident when you see the large intestine. I will show you that diagram also, don't worry. Actually the artery is called as, okay, the marginal artery of Drummond. So when you see the large intestine and colon, we have got the marginal artery of Drummond. So the marginal artery of, the name is, okay, yeah, okay, so yes, so marginal artery of Drummond of the colon as important anastomosis which is occurring in large intestine. So it runs around the border of large intestine and it is formed by the anastomotic network between the branches of ileocolic artery, right colic artery, middle colic, left colic and sigmoidal artery. So that means branches of superior mesenteric artery and that of inferior mesenteric artery, and the artery which is formed is called as marginal artery of Drummond. Let me show you the image. So see here, anastomosis which is formed from in between left colic artery and sigmoidal artery. These are the branches of inferior mesenteric artery, and here the branches middle colic, right colic, ileocolic. These are branches of superior mesenteric artery. This two joins and forms the marginal artery of Drummond, forming marginal artery of Drummond, which is shown in this diagram. Okay, got it? Now if a small artery is occluded, actually what happened, these anastomotic network is very useful because if small arteries are getting occluded, the branches of this anastomotic network will allow blood to be given to the segments of the colon. Okay, so that is an alternate pathway for the blood flow. Now these arcades are prominent in small intestine than the large intestine, and The arterial recte was given the option. Actually, when you see the loop of jejunum and that of ileum, and you go for dissection, and all in the visceras also, if you will see the mesentery, in that mesentery you will see this straight artery. Recte, the word recte means straight artery. So these are small straight arteries which are the smaller branches running from marginal artery. So this is the reason that artery of Drummond is not the recte artery, but it is the marginal artery. So this is wrong option. So we will go with marginal artery as the correct answer. Okay. Other than that, when we talk about ileocolic artery, it's a branch of superior mesenteric artery, and subsequently ileocolic artery is an important branch from the superior mesenteric artery which is giving blood supply to cecum, appendix and terminal part of ileum. It is exactly not which is forming the marginal artery. The coronary arteries we clearly know that coronary, right and left coronary arteries are giving blood supply to the heart, but it is just given to confuse you, because when we are talking about gastric vein, at times the gastric vein is referred to coronary veins. Why it is referred to coronary veins? Because they crown the lesser curvature of the stomach. The reason is that, please note down this point, that in terms of the veins related to the lesser curvature of the stomach, gastric vein is also called as coronary vein because it is lying as a crown over the lesser curvature. So these are wrong option. Only the marginal artery is the correct answer. Let's move on to the next question, number 5. A patient presented with swollen spleen which protruded medially towards the umbilicus in the abdomen. A vertical and downward extension of spleen was resisted by which of the following structure? Question number 5. So swollen spleen is there and it is protruding medially towards umbilicus. A vertical downward expansion of spleen, if is there, it is limited by body of pancreas, left splenic artery, left renal artery or left colic flexor. According to you, which is the correct answer? Question number 5, mark the correct answer, my dear. Question number 5. Okay. Which is the correct one? Okay. So waiting for others to reply. I got one answer, C. Okay. So C is perfectly correct answer. Left colic flexor is the correct answer. C is perfectly correct. Okay. So my dear aspirants, the left colic flexor, actually the other name of left colic flexor is, it is also called as splenic flexor. So both are similar. Left colic flexor is also called as splenic flexor. It is the point where the colon is taking a sharp downward turn. Now this is the point where transverse colon is ending. So actually when we talk about left colic flexor, the transverse colon is ending and getting started to form descending colon. So junction of transverse colon and descending colon on left hand side is called as left colic flexor. So it lies exactly inferior to the spleen, and this is the reason that we will mark left colic flexor as the correct answer. Okay, so it is just lying inferior to the spleen. So in case of enlargement of the spleen which is moving just medially, the left colic flexor will avoid its downward distension, okay, or extension. So we will go with left colic flexor as the right answer. Let me show you. So exactly if you will see this diagram, what you can appreciate in this diagram, that this is whole the outline of the spleen, and just on the lower aspect you can see left colic flexor is residing. That is the junction of, this is transverse colon and this is the descending colon. Okay, this is descending colon. So at the junction of descending and the transverse colon, there is location of left colic flexor, and left colic flexor is preventing, as you can see in the diagram very nicely, it is preventing the downward descent of, spleen. The stomach, the other important options like stomach has been mentioned. Stomach is lying medial, where it's a wrong option. Why? Because stomach is lying medial to the spleen and the tail of pancreas inserts into the hilum of the spleen. The organ would not prevent the spleen for descending downward. Descent of downward is prevented by left colic flexor. Kidney and left renal arteries are retroperitoneal structure, so they do not obstruct the movement of the spleen. So all other option is absolutely wrong. Why they are wrong? also has been mentioned here because they are not lying in the inferior relation of the spleen. Let's move on to the next MCQ, MCQ number 6. Choose the correct option regarding relation of marked area from lateral to medial. So I just want to tell you about 4 structures are related on the ala of spleen. Sorry, 4 structures are related on the ala of sacrum. So these 4 structures, what are they? 4 structure which is related at the ala of the sacrum. So from lateral to medial, what is the correct order of the structures related? Whether it is whether the option A is correct, B, C or D. So we know that at the sacrum ala 4 structures are related from lateral to medial. You have to know the correct order. So please mark the correct answer A, B, C and D. According to you, which is the correct answer? So Mangla has given the answer. What about others? Okay, Shreya Das has also given the answer. Okay, dear. Question number 6. Okay, I got an answer from Shreya and Mangla. Okay, so yes, my dear aspirants, the correct answer is A, absolutely correct. Okay, so actually the structures related on the ala of sacrum can be memorized by the mnemonic oils. The structures related on the ala of sacrum can be memorized by the mnemonic from lateral to medial. The correct order of relation is from lateral to medial on the ala of sacrum. So here the lateral most structure is obturator nerve, I for iliolumbar, L for lumbosacral trunk and S for sympathetic chain. So from lateral to medial 4 structures are related. The lateral most structure is obturator nerve, then we have got iliolumbar artery, then we have got lumbosacral trunk and then we have got sympathetic trunk. I would like to show you this diagram also. The smooth part of the ala of sacrum is related from medial to lateral. Thus the opposite, if we talk about the relation of the structure from medial to lateral, it will be sympathetic chain, lumbosacral trunk, iliolumbar artery and obturator nerve. All these structures which is lying on the ala of sacrum is overlapped by psoas major muscle. Let me show you a diagram so that your concepts get cleared. So this is a diagram where you can see the structures related. So here from lateral to medial or from medial to lateral, you can say if we proceed from medial to lateral, if we proceed from lateral to medial, oils. Lateral most structure obturator nerve, iliolumbar artery, lumbosacral trunk and sympathetic chain. Correct? Now, same thing here also you can see obturator nerve, iliolumbar artery, lumbosacral trunk and sympathetic trunk. These are the structures related in the ala. Other than that, piriformis muscle is related, median sacral in the midline, iliacus. So all other structures which is related here, coccygeus and levator ani muscles. So more of the structures which is related on the sacrum has been visualized in this diagram. So just see this diagram which will give you a better understanding. ठीक है, all structures दिख गया related on ala of sacrum, previous year NEET PG question. Let's move on to the next, that is question number 7th. Which of the following structure lies in intersigmoid recesses? Which of the following structure is located in intersigmoid recesses? Whether it is left ureter, whether it is left ureter, left common iliac vein, left ureter, left common iliac artery, or the 4th one. According to you, which is the best answer, dear? Best answer? Best correct answer. Which of the following structure lies in the intersigmoid recesses? Intersigmoid recesses. Which is the best correct answer? Okay, okay, let me tell you about the correct answer. Actually, intersigmoid recess is just containing left ureter. Please note down, it just contains the relation of left ureter. Okay, direct MCQ. So I would just like to show you this diagram. Here you can see the intersigmoidal recesses. Okay, sigmoidal mesocolon. The sigmoidal mesocolon, you can see the inverted V shape is this. This is the apex here, and you can see here it's triangular in outline, and it is intersigmoidal recess is just related to left ureter. So only left ureter is the correct answer, dear. Left ureter is the correct answer. Now let's talk about the next MCQ. Accessory obturator artery is branch of which of the following artery? Inferior epigastric, external iliac, internal iliac, or obturator artery? Which is the correct answer? Accessory obturator artery is branch of inferior epigastric, external iliac, internal iliac, or obturator artery. Question number 8. Mangla has given the answer. Rochin Mangla. What about others? Absolutely correct. Yes, inferior epigastric artery is absolutely correct. Normal obturator artery. Can anybody tell me normal obturator artery is a branch of which artery? Normal obturator artery is a branch of? It's a branch of anterior division of internal iliac artery. Anterior division of internal iliac artery, obturator artery. Okay, normal obturator artery. Now, if I talk about accessory, अगर हम accessory obturator artery की बात करते हैं, then it is actually the pubic branch of inferior epigastric artery. Pubic branch of inferior epigastric artery. Now, its clinical importance is there, so it is important for us to know. Actually, at times this accessory obturator artery, abnormal obturator artery lies in relation with the medial aspect of femoral canal. It is lying over lacunar ligament, and at times of strangulated femoral hernia, we want to enlarge the hernial sac. So, accidentally it can lead to the cutting of the pubic branch of inferior epigastric artery, which is the accessory obturator nerve, and it can lead to enormous bleeding. Okay, so this relation is very important for the surgeons to know. So, see here in this diagram you can see the abnormal obturator artery, which is a pubic branch of inferior epigastric artery contributing to accessory obturator artery. And here if you will see the diagram very nicely, you can appreciate this triangular ligament on the medial aspect, which you are seeing is the lacunar ligament. So it is exactly related on the lacunar ligament, and it will lead to the cutting of lacunar ligament and injury of abnormal obturator artery being involved and cutted and leaded to enormous bleeding. So you can see hernial sac is looping out, and it is if it is strangulated, immediate operation and enlarging of the opening of the sac and just retrieving it back onto the abdominal cavity has to be done. So in that case we want to cut and enlarge the space. So for enlarging the space we can't go laterally. Why we can't go approach laterally? We can't approach laterally because we have got femoral vein and artery residing here. But on the medial side we have got lacunar ligament which can be cutted out, but if abnormal obturator artery is related here, it can lead to enormous bleeding. Okay, now I also want to show you this diagram where you can appreciate that this obturator artery is a branch from internal iliac artery. To be more specific, it's a branch from anterior division of internal iliac artery. Other branches of internal iliac artery is superior vesicle, inferior vesicle, middle rectal, internal pudendal, and inferior gluteal. The two other arteries which is shown here, lateral, sacral, superior gluteal, these are the branches of posterior division of internal iliac artery. Okay. Okay, we have so many times talked about these branches in detail, so I will move on to other. We know that abdominal aorta divides into two common iliac artery at the level of L4 lumbar vertebra, and this common iliac artery again divides into external and internal iliac artery. Internal iliac artery is a blood supply for the pelvic structure, and one of its most important branch which traverses the obturator foramen is the obturator artery. Inferior epigastric artery is a branch of external iliac artery, and it gives a pubic branch which sometimes takes part of obturator artery because its pubic branch can anastomose and replace the main obturator artery. So in other case, the pubic branch of inferior epigastric artery joins obturator artery and it is called as accessory obturator artery. The main clinical aspect which is related to it is that at times it will be located over lacunar ligament. So at times the accessory obturator artery has got relation over the lacunar ligament. Okay, we clearly know that this lacunar ligament is forming medial boundary of femoral ring, and in case we want to enlarge the space, we want to cut out the lacunar ligament, so the surgeon should be very careful while performing this surgery and endoscopic repair of this femoral hernia. Why? Because lacunar ligament can accidentally lead to the cutting of accessory obturator artery and enormous bleeding can occur. This could lead to enormous bleeding. Okay, my dear aspirants, let's move on to the next MCQ. During a laparoscopic cholecystectomy done on 61-year-old man, which of the following artery must be clamped properly to remove the gallbladder safely? Options are common hepatic, proper hepatic, right hepatic, left hepatic or cystic. According to you, which is the best answer? Question number 9. So here laparoscopic cholecystectomy has been performed on 61-year-old man. So which artery has to be clamped to remove the GB gallbladder safely? That means you have to know the artery which is giving blood supply to gallbladder. Easy one. The artery which is giving blood supply to gallbladder. Cystic artery, absolutely right. Yes, we know that cystic artery is the correct answer. Cystic artery is giving blood supply to gallbladder. So this should be clamped. For laparoscopic cholecystectomy, bleeding can occur from cystic artery. So it should be clamped in the patient. This is a direct MCQ only. Cystic artery is the only artery listed which is directly going to the gallbladder. Cystic artery is a branch of right hepatic artery. So it's a branch of right hepatic artery and must be clamped before removing the gallbladder. And it should be free from the attachment. The common hepatic artery is giving origin to proper hepatic artery. The proper hepatic artery gives right and the left hepatic artery, and the right hepatic artery will give cystic artery. Common hepatic artery providing origin to proper hepatic artery again giving origin to right and the left hepatic artery, and these are giving blood supply to gallbladder, biliary tree and that of the liver. Got it, everyone? I would like to show you this diagram. See here. So here nicely you can see the proper hepatic artery. In this diagram you can nicely see the proper hepatic artery. You can clearly see the proper hepatic artery. This is the proper hepatic artery. Okay, this proper hepatic artery is dividing into right artery, right hepatic artery and that of left hepatic artery. This is left hepatic artery and this is right hepatic artery. The right hepatic artery is again giving cystic artery which is giving blood supply to gallbladder as shown in the diagram. Okay, let's move on to the next, that is question number 10th. Injury to which of the following muscle may lead to urinary incontinence along with cystocele, rectocele and prolapse of uterus? Whether the structure is ischiocavernosus, whether the structure is pubococcygeus, whether the structure is bulbospongiosus, whether the structure is urethral and anal sphincter. 4 options are there, mark the correct answer. Question number 10th. Okay, Mangla B with a question mark. What about others? So, great performance, Mangla dear, great performance. Here the correct answer is Pubococcygeus is which muscle? Actually, the muscles which is lying in one of the important muscle, that is the levator ani muscle, and the coccygeus muscle. Levator ani muscle is providing support. It's providing a part of pelvic diaphragm, and it is supporting the pelvic structures and the organ. So here pubococcygeus is the muscle which is the part of levator ani muscle. So if there is an origin, if there is an injury to pubococcygeus muscle, it can lead to urinary incontinence, cystocele, rectocele, and prolapse of uterus, because these structures are getting support from the inferior aspect. They are not dragging lower down because of the presence of pubococcygeus part of the levator ani muscle. Okay, so we have got B as the correct answer. Also, this pelvic diaphragm has got a gap for the opening of urethra, vagina, and the anal aperture. Through this there is an opening, and it is getting support with the parts of levator ani muscle and levator ani muscle, and also the part of coccygeus muscle. Levator ani muscle has got part ischio-coccygeus, ilio-coccygeus, and pubococcygeus. So see here in this diagram, you can see the superior view of levator ani muscle. If you want slightly, I will enlarge it. Yeah. Okay, see here. Now you can see here it is having an opening in the anterior aspect. This opening is called as urogenital sinus, and this other opening is the anal hiatus. In case this is a case of male. In case of female, there is or vaginal orifice also. And the parts, we have got puborectal muscle as its parts. So we have got puborectal muscle as its part. We have got pubococcygeus, which was the correct answer for this MCQ. This is also the part, this is the pubococcygeus. We have got the coccygeus muscle, and we have got the iliococcygeus muscle. Okay, so this is iliococcygeus muscle. So all together you can see this part is the okay. So see here. So we have got the components of the muscles which is shown here. So here we have got the puborectal sling. Okay, the other sling which is shown here is the sling which is formed by the pubococcygeus muscle. Iliococcygeus muscle is there. Iliococcygeus muscle is there, as you can see here. Iliococcygeus muscle. We have got the pubococcygeus muscle. Puborectal sling, we have got the pubococcygeus muscle, and we have got the coccygeus muscle. More posteriorly, here we have got the coccygeus muscle. Coccygeus muscle. So if there is an injury to pubococcygeus muscle, it will lead to the loss of integrity of pelvic diaphragmatic support of the pelvic structure, and it can lead to prolapse of the urinary bladder, rectum, or uterus. Okay. So got it, everyone? Yeah. So let's move on. Before ending the session, I would like to tell that tomorrow I have got 2 sessions on the free platform of Unacademy. Free platform, free sessions. So 6 p.m. session and 7 p.m. session. 7 p.m. session is the embryology MCQ discussion, general embryology MCQ discussion session, and 6 p.m. session will be the discussion of discussion for the first year MBBS prof exam. First year MBBS prof exam, important questions. The students who are watching the session for the first time, they want to appear for the free session and solving the MCQs should present unlock code. They should use ANAT10. Link of my session is provided on the Let's Crack NEET PG and all Unacademy Telegram group. So do present live for this session. I would also like to give you the information regarding my session, that is the anatomy test series, which is going to happen on 21st January. 9 p.m. is the timing, my dear aspirants. And you can get enrolled by using the code ANAT10. So use this code, get enrolled for this test. The test is of anatomy subject, which MCQs are made by me, and rank 1st, 2nd and 3rd will get exciting Amazon vouchers free. Okay. Also, I want to give you the information regarding the another test, that is NEET PG Compact, which is going to happen. This NEET PG Compact is going to happen on 23rd of January. 23rd January, 11 a.m. Okay, the MCQs are from the final year subjects medicine, derma, anesthesia, radio and psychiatry, and lucky participant till the rank 2, so till the rank 200 rankers will get a scholarship of the NEET PG plus subscription. Other than that, 50 participant will be provided with amazing gift vouchers. So pool of 10 lakh rupees is there. So just get enrolled by using the code NEAT10 and do participate in January 23rd 11 AM test NEET PG QBank. Boost your medical preparation by taking the subscription of Unacademy. If you are going to take 2 years of subscription, 4 months is absolutely free to you. If you are going to take 12 month, 1 year of subscription, 2 months is absolutely free. Use this code NEAT10 to get extra discount of 10%. So all those who are planning, they can use this code and take the subscription. Also, I want to show the pricing detail and the comparison detail which has been done between the Plus and Iconic subscription. So you can have the comparison, and then it will help you to decide to go for which. I would suggest the students of NEET PG aspirants, the students of Next should definitely go for Iconic subscription, and they can use my code for getting extra 10% discount. All the best. Thank you so much. We will meet again with the upcoming session. So tomorrow you can be present live for the session of special free platform pay. Use karo NEAT10 as the code to unlock the session and be present for the MCQ session, and first prof students can be present for the university exam important questions. All the best. Keep studying. Thank you so much. Thanks.